Sisk. I'm a student nurse practitioner. Hello, my name is Erin Sisk. I'm a student nurse practitioner at Maryville University, and today we're going to complete the head-to-toe assessment. This is my volunteer for today. Her name is Tiffany. She's going to be completing the head-to-toe assessment with me. Before Tiffany arrived, we did get a full set of vitals. We checked her height and weight. We also did the near vision screening and the Stalin eye chart screening for distant vision. We washed my hands during the exam, and Tiffany was asked to be placed into a gown, which she has done. So first, with starting the head-to-toe assessment, we'll first start by just general appearance of Tiffany and assessed her gait when she walked in. We'll assess by looking at her head, just making sure her head is normocephalic, that everything on her face is symmetric and midline. I'll assess her scalp, noting for any lesions, for any masses, and assessing her hair as well while I'm doing that. The texture, that it's evenly distributed throughout her hair, which it is. Also just assessing the face for any visible lesions or masses as well, and the skin, the characteristics of her skin on her face. Next, we will, I'm just going to kind of assess her facial bones in general, just making sure there's no tenderness or anything or pain to her facial bones. Okay. Next, I'm going to assess her temporal mandibular joints. So I'm going to have you open your mouth and close. Did you have any pain or tenderness with that? And I'm also assessing to make sure that there's no clicking or popping when she does that as well. Next, I'm going to palpate the sinuses in the facial. I'm going to palpate the frontal sinuses and the maxillary sinuses, and just assuring that there's no pain or tenderness in there. Next, I'm going to do a little light sensation to Tiffany's face, assessing some of the cranial nerves. Okay, Tiffany, if you'll just close your eyes for me. Just move your head to the side. Okay. And put a little swab on your face and just let me know if you feel equally on both sides. I do on the forehead. Okay. I do on the cheek. And I do on the jawbone. Okay. Good. All right. Now, Tiffany, I'm just going to do a few little tests of the cranial nerves with Tiffany. So, Tiffany, if you'll just squeeze your eyes shut for me. Good. You'll wrinkle your forehead. Good. You'll puff out your cheeks and stick your tongue out. Move it side to side. Intact, just in smile for me. Those are intact. Next, I'm going to move to assessing Tiffany's eyes. So again, I'm going to first look at the external characteristics of her eyes, making sure they are symmetric. Making sure her eyebrows are full, that her eyelashes are, the eyelashes, the hair is evenly distributed, and that they extend upward and outwards. I will assess the sclera and conjunctiva, making sure that the sclera is white and the conjunctiva is pink. So Tiffany, if you'll just look up for me. Good, which it is. Also, we'll just make sure that there are no lesions or masses or drainage around that. Next, I will do a little pupillary response to assure that her pupils are equal and reactive to direct and consensual light. So I'm going to get my pen light. Okay. So to me, if you'll just look straight ahead at the point at the wall, I'm just going to test direct and consensual, and again, direct and consensual as well. Next, I'm just going to test Tiffany's 6 cardinal fields of gaze. So Tiffany, I'm going to have you just watch this pen light. Now I want you to keep your head straight and just follow it with your eyes, okay? Mm-hmm. All right, good. So that is intact. Next, I'm going to do the cover uncover test. So Tiffany, if you'll, we'll cover your right eye with your right eye. Good. And you can put it out and then cover your left eye with your left eye. Good. And here I'm just assuring that Tiffany has no drooping in her eyes, that there is no extraocular eye movements as well, and all that is intact. Next, I'm going to assess Tiffany's ears. We're going to go to that. I'm going to, again, assess the outer auricle, looking kind of behind the ear, assuring that there are no lesions or masses there in both ears, looking at that. Also assuring that that her ears are at midpoint with her eyes, which they are. Then I would assess the internal, or the ear canal, excuse me, with the otoscope. We'll get that in a minute. So I would just pull her ear up and back and look in and assess for any drainage, that the tympanic membrane is intact and pearly gray, that there's no redness. Again, assess that with Tiffany. So Tiffany, I'm going to stand behind you and I'm going to whisper a series of some words and just let me know what you hear, okay?
3TN. 3TN.
That was the whisper test. Now I'm going to use my tuning fork, and we're going to perform the Weber and the Rhine test. So I'm going to strike my tuning fork, and I'm going to place it on top of your head, Tiffany. Just let me know if you hear equally in both ears or greater in one ear, okay?
Equal in both.
Good. All right. And now I'm going to test the Rhine test, which is air conduction versus phone. Tiffany, I'm going to place this behind Tiffany's mastoid process, and you're going to just let me know when you no longer hear the sound, and then I'll move it to the outside of her ear canal, and then again, just let me know when you no longer hear that sound. I'll also be watching the clock while I do this to assess air conduction versus bone conduction.
Now. Now.
Good. All right, and that should be at a ratio of 2 to 1. So we're done with the ear exam. Next, I'll move to her nose. I'll just again assess that her nose is midline, assess the outer features of her nose, making sure there's no lesions or masses on the outside of her nose. Sorry, I'm gonna grab my light. I would go look in her nostrils, assuring that the septum is not deviated, that there's no polyps, there's no drainage or redness or swelling. And I'll also assess the patency of her nostrils. So Tiffany, if you will put your finger over your right nostril and kind of breathe in for me. Good, and then same with the left. Good, and that's assuring that her nostrils are patent. Next, we are going to move to the mouth, and we're going to, again, just assess that her lips are symmetric, that there's no lesions or dryness or cracked lips or anything like that. Then I would assess her in her mouth, and I'm going to put some gloves on for this. And we're going to be first looking kind of at her gums, assuring that they are also nice and pink, that they're not bleeding or anything like that, or receding. So good, her gums look good. We're also looking at her teeth, looking at how many there are, making sure there's no missing, chipped, or cavities or anything like that, which they are not. Now, Tiffany, if you lift your tongue up to the top of your mouth, good. And I'm just, again, looking at the floor of her mouth, making sure there's no oral cancer sites, any lesions or masses down there. And Tiffany, if you'll move your tongue to your side of your cheek to your right, good, and to your left. Also assessing the sides of her mouth as well, looking for any lesions or anything like that. I'm assessing her tongue. You could just stick your tongue out and say, ah, for me. Good. And I'm assuring that her uvula is midline and it rises and falls when she says, ah. I'm also, again, open your mouth and say, ah, good for me. Good. Making sure that the posterior pharynx, that there's no redness or drainage or swelling. Her tonsils are not enlarged. And that looks good with her mouth. I'm also going to test her gag reflex with a tongue blade. Okay, Tiffany. Make this tongue, okay? So just open your mouth and say, ah, really? Good. Sorry about that. So that is testing Tiffany's gag reflex, and that's testing cranial nerves 9 and 10. So now from the neck, excuse me, we'll move, or excuse me, from her mouth, we'll move down to Tiffany's neck. So again, I'm just now looking at Tiffany's neck, assuring that the trachea looks midline, that there's not a fullness or edema noted to her neck, that there's no any visible lesions or anything or masses on her neck that I've noticed. Help to assure that it is midline, which it is. While I'm here, I will also assess the thyroid, and again, just ensuring that it is not enlarged or anything. So Tiffany, if you'll just give me a swallow for me. Good. Just assessing that. Next, I would, if I was looking for a JVD, I would have her probably at a 45-degree angle to assure that there's no jugular vein distension, which there's none. Next, I would assess her carotid arteries, and by doing that one at a time, I first would palpate the carotid arteries. Then I'll also listen, and I'm making sure there's no bruise in the carotid arteries. And then again, listening one at a time. I'll listen with the bell of my stethoscope. Okay, Tiffany, you'll take a deep breath for me. Hold it. Good, good breathe. And take another deep breath and hold. Good. Good. While I'm here, I'll also listen for any bruise over the thyroid gland. Next, I will assess her lymph nodes in her neck. The occipital, the tonsillar, submandibular, submental, the cervical chain, the deep cervical, the supraclavicular, the infraclavicular lymph nodes, and then Tiffany, if you'll just raise your arms. I'd also check the axillary lymph nodes as well, and just assuring that there's no lymphadenopathy and they are not palpable, making sure that they are not tender or anything like that as well. Next, I'm going to do just a little bit of range of motion of Tiffany with her neck, just assuring that her range of motion is intact and smooth. So Tiffany, if you'll just put your right ear to your right shoulder, and then the left ear to your left shoulder. Good. Put your head forward, and then all the way back for me. Good. And no pain or tenderness with that. Her range of motion was smooth. Next, I'll have you just shrug your shoulders for me. Good. And I'm just going to put a little resistance there, not shrug them again. Good. And that's testing cranial nerve 11, which is intact. There's no issues with that. So now I'm going to kind of just move down to Tiffany's extremities, her upper extremities. I'm also going to note the muscle mass on each, that it is equal, assessing the skin, that there's no visual lesions or masses on her upper extremities. Her skin is warm, there's no edema, it's smooth. I'd assess her hands, again, looking for any lesions or masses, looking at her nail beds for the nail characteristics, making sure there's no clubbing. I'd assess the cap refill at this time, and assure that it is less than 3 seconds on both fingers. Next, I'll also palpate her brachial and radial pulses on both sides. So first the brachial, and then the radial pulses. Good. Next, we are going to move to Tiffany's posterior chest. So I'm going to have Tiffany turn around here for me. All right. So, again, we're going to look at Tiffany's posterior chest, looking at the thoracic configuration, also watching her respirations, making sure that they are even and unlabored, just making sure that you're scanning the chest that I don't see any visible lesions or masses. I'm going to check thoracic expansion by placing my thumbs at the 10th intercostal space here. Tiffany, just lean slightly forward for me. And take a deep breath for me. Good. And my thumbs should rise and fall easily with respirations. And that's, again, assessing her expansion. Next, I'm going to assess tactile ephemeris to assure that there's no visible pulsations or anything like that in her chest or vibrations. So, Tiffany, I'm going to place my hands on your back and I'm going to say 99. Or I want you to say 99.
Okay.
All right. Sorry. All right.
99, 99, 99.
Good. Now I'm going to percuss her posterior chest in a systematic fashion, just assuring that normally you should hear resonance and making sure that I don't hear any areas of hyperresonance or dullness. Good. And also going to percuss her costovertebral angle. Good. And then the last thing I'm going to do on her posterior chest is for assess for diaphragmatic excursion. So Tiffany, I'm just going to have you lean slightly forward again. I'm going to again percuss from the bottom up, and I'm going to assess to hear for the changes from resonance to dullness, and that will let me know where I'm at the diaphragm. So I'm going to start percussing there. Good. And then I would mark this with a piece of tape or a pen. And I'll start from the top and again percuss down until I hear that sound change again and mark that. And that normal finding should be 3 to 5 centimeters, which it is. So that last thing I'm going to do in the posterior chest, is auscultate breath sounds. And I'm going to also do that in this systematic fashion, starting right to left, and assess for clear breath sounds, assure that there's no crackles or any wheezes or rhonchi or anything. So I'm going to also take her breath sounds. Okay, deep breath in. Deep breath. And I'm also going to assess her lateral breath sounds. So Tiffany, if you don't mind raising your arms here for me. Deep breath. Good. All right, and that's finished with her posterior chest. Now we're going to have you, Tiffany, turn back around, and I'm going to assess her anterior chest. Again, just watching her respirations, assuring that they are even and not labored. I also assess tactile ephemeris from the anterior chest. So Tiffany, again, I'm going to put my hands on your chest, and I want you to repeat 99 for me, okay?
99, 99,
Good.
99.
Good. I also am going to assess the precordium. I'm going to palpate that and just assure that there's no any thrills or heaves or lifts. Okay. And while I'm done here, I'm also going to feel for the apical pulse. Assure that it's, the rate is regular, their regular rate and rhythm. I'm also going to percuss Tiffany's anterior chest as well, assuring that I hear resonance, no hyper resonance or dullness. Okay. After I've done that, I'm going to auscultate her anterior breath sounds as well, ensuring that they are clear. All right. Next, I still have my stethoscope, I'm going to auscultate Tiffany's heart sounds. I'm going to assess her aortic, pulmonic, her Irv's point, tricuspid, and the mitral. And I also make sure that there's no murmurs, rubs, or gallops when I listen. Just assuring that that is all intact. Next, we are going to move to Tiffany's abdomen. All right. Make sure that you can see, okay. All right, so first we'll start with a general inspection of her abdomen. I'm going to use my pen light and assess the contour of her abdomen, making sure that her abdomen is moving evenly with her respirations, that there's no visible pulsations or pulsatiles, and it looks good. But also assessing the skin, that there's no lesions or masses on her abdomen. And then I'm going to begin by auscultating her bowel sounds in all 4 quadrants. I'll listen to up to 2 minutes. And if there's any concern that I do not hear bowel sounds, I will listen to up to 5 minutes. So I'm going to start with that. While I also have my stethoscope on, I'm going to assess her abdominal aorta with the bell of my stethoscope and also listen for any bruits. I'm going to also assess her renal arteries. Left, right renal, the left iliac, the left femoral, and the right. Good. Now I'm going to also percuss Tiffany's abdomen, and here I'm just going to do a general percussion in all 4 quadrants. Hi there. Hey, we're just this. Let me stop this.